Hi my beautiful friends, welcome back to my channel. My name is Kimberlee Ramirez and I am a speech language pathologist as well as a certified auditory verbal therapist. And today I'm here to talk to you about what is auditory verbal therapy and does your child need it, and a little bit of myths and facts about auditory verbal therapy, and so that you guys can have a bigger picture of what it is that I do and why it's important and who it's for. So first off, AVT, it's often referred to, and I am a certified AVT, and that just stands for auditory verbal therapy, and that is a method of communication for kids who have hearing loss. Now, often the kids that I work with have amplification, which means hearing aids or cochlear implants. And if you're not familiar, cochlear implants are basically a surgically implanted hearing aid that really assists kids who have more of a severe to profound hearing loss and would be considered deaf. They're actually able to hear and detect all of the speech spectrum once they get one. Auditory verbal therapy is also known as listening and spoken language, and I would be considered a listening and spoken language specialist. Now, a couple websites that you can refer to get some more information. My favorites are hearingfirst.org. They're so phenomenal. Please check out their videos. JohnTracyClinic.org, so JTC.org is number 2, and number 3 is handsandvoices.org, and that is a little bit more comprehensive on all of the different communication methods for kids with hearing loss. Now, I want to tell you a little fact. There are over 600,000 children in the US that are school age that have hearing loss. So this is actually a pretty common thing. And a lot of parents and I feel like the mainstream just in the public don't have a lot of information on what are their options and what to do when your child has hearing loss. And most parents think, oh, I have to learn sign language, and that's not necessarily true. A lot of families do opt to learn it at some point, but it's not necessary. Your child would be able to communicate with listening and spoken language given all the right factors, including having the support and getting early amplification. And what listening and spoken language and auditory verbal therapy are teaching children to communicate verbally using verbal language through listening. So like I said, the children that I see often have amplification, hearing aids, or cochlear implants, and we're using that listening in order to help them develop typical speech and language. And that's the goal. And the goal also is to help these children to be successful in a mainstream environment. So that's the ultimate goal, is that these children can be able to go to school with their hearing peers, to be in regular public school or private school or charter school, whatever you want to go to, but to be able to participate in a classroom, just as you and I would with their typical hearing peers. Often parents also opt to go to either a school that has deaf and hard of hearing peers as well. Those are often called DHH programs, deaf and hard of hearing, and those would also have other peers that have hearing loss as well. And those programs can vary in the types of children that they see as well. And sometimes, in certain cases, children with hearing loss are placed in like a special day class, especially if there's something else going on sometimes, which is also common as well. Another thing to think about is that listening, language, and communication are foundational in the development of a child's personal, social, and academic life. Think about, if you don't have language, you can't learn. And that's not 100% true. You can learn lots of things non-verbally, but to learn academically, you need to have words, you need to have language, you need to have a method of communication. So it is really the foundation, and we have this critical period, this time after birth from 0 to 5 especially, this really important window where children's brains are literal sponges and they are able to access and learn language. Not to say that children can't learn language after age 5, but just the window diminishes and it becomes more difficult for the brain. It takes a lot more work, but that's okay. So if we do not have hearing before age 5, especially if language and hearing is not accessed during the critical language learning window from 0 to 5, their ability to learn language, to acquire language verbally, will diminish over time, and I'll get into that as well. And the good news too is as verbal language increases, their ability to read, their ability to engage in conversation and social skills also develop with this type of therapy. So now I'm going to get into some myths. Myth number 1 is that you cannot use ASL, and that is a big myth, and that's what parents bring to me often, is they want to use ASL and I feel torn. Am I able to use ASL? And my personal philosophy is absolutely that you can, but there's a philosophy that goes underneath that is important to realize, kind of like I talked about, that critical 0 to 5 window for the brain's ability to learn language. When a child is born with hearing loss, their brain starts to reorganize. You know, that age-old saying that if one sense is diminished, the other senses go stronger is actually true. So children with hearing loss, their sensory cortex, their sensory perceptions, as well as their visual cortex actually get stronger when their auditory cortex is weaker. Now, so these children are hypervisual and hypersensory, and so learning a language like ASL is natural to them. It becomes actually easier than learning an auditory language. However, if we miss this window from 0 to 5, their ability to learn verbal auditory language diminishes significantly. So what parents often have to wrestle with is, are we going to focus on listening and learning language auditorily in that critical window, and then can we learn the visual language, because they will always have vision, they will always have that available to them, and that will always be a strength. So often parents will learn and focus on listening and spoken language in the first 0 to 5 years, and then switch to focusing on ASL as they get older, so that they can participate in the deaf community as well, and also, you know, have that part of their identity. So it's definitely not, and I do not forbidden or taboo or anything like that. You can definitely use ASL, and it also can provide a wonderful foundation before they have amplification. So there's often a waiting period from when you first find out your child has hearing loss, and then to actually getting the hearing aids and the cochlear implants. And that time is a wonderful, wonderful, wonderful time to use ASL as building a foundation for language. And often I will teach parents how to incorporate that and how to help their child, using it as a bridge even for listening and spoken language as well. And I'll get into that a little bit more. And I've had also some families that do ASL alongside listening and spoken language and have been very, very successful. It does take a little bit more work, and I would be happy to work with you on that. Myth number 2, babies don't need speech therapy or auditory verbal therapy. They can't talk. Why would you see a baby? And to that, I would say babies are the most important children. That's not great to say, not the most important, but babies are the best age to see for listening and spoken language. They're the best age to see for auditory verbal therapy, because most often they can actually achieve what's called developmental synchrony. That means that they can catch up to their hearing peers in a short amount of time, because we're in this critical window, and we can move them along. Once we have some hearing that we can work with, then we can move them along these speech and language milestones really, really quickly. And if you are interested in learning about speech and language milestones, check out my other little series that I have on YouTube. But babies do come to auditory verbal therapy, and I've seen clients as early as 6 months old in auditory verbal therapy, and done some coaching sessions as early as 3 months old. So they 100% actually can participate, and it's more also about training the parents in how to maximize their communication with their child, how to maximize what they're doing, so that, and keep, you know, the hearing aids and cochlear implants on, and how to build that language foundation and set them up for success. Okay, myth number 3. Auditory verbal therapy is only for children implanted with cochlear implants or amplified under age 3, and that's not true. I have seen plenty of children who got their cochlear implants later in life. I've seen lots of teenagers who had hearing aids their whole life, and then all of a sudden got a cochlear implant and want to work on their listening skills or refine their speech skills. So that's absolutely not true. We can see people at any age, and I've seen adults as well, and that's more called oral rehabilitation, but it's also using a lot of auditory verbal therapy principles as well. And the focus is to help people maximize their listening with their cochlear implants and with their hearing aids, and how to access speech and language. A lot of it's listening focused rather than verbally focused, and from good listening comes good speaking. Okay, and the goal is to really help them self-monitor. So if you have really good listening skills, your speech will naturally get better. Babies refine their speech through their own hearing as well. So we kind of build that foundation in their brain so they're able to kind of correct their own based on their hearing and their feedback. Okay, myth number 4, the more therapy, the better. I have a lot of parents saying, like, can we see you 4 days a week? Can we see you 5 days a week? And the more is not necessarily better in that case. Auditory verbal therapy is supposed to be a coaching session. It's like seeing a personal trainer in a workout regimen, where it's best, parents are their child's first and best teachers. And if I can teach you how to do my job, if I can teach you how to be an auditory verbal therapist, your child is going to do exponentially well, because you're going to be doing the strategies in normal life all the time. And if that's the case, your child's going to make so much more progress than if they were just seeing me for a few hours, because they have you for 18 waking hours a day or all the time. And so that is even way better if I can coach you, if I can teach you how to do it, rather than me doing it for you. You're not going to make the progress. You're not going to see the results that your child really needs unless you are the one that's actually implementing and incorporating them. So more is not necessarily better. I would say 2 times a week is kind of the maximum that I've seen recommended for auditory verbal therapy, unless you're in like an actual program. I've worked in a cochlear implant school where kids got 3-4 days a week, but it was a little bit shorter segments, and it was a school for kids with cochlear implants, and that's Weingarten Children's Center up in the Bay Area in California. And myth number 5, is that my child will need auditory verbal therapy and speech therapy forever, or the opposite. Or I often get asked, how long will my child need speech therapy? And that's a wonderful question, and it depends. It's a case-by-case basis. I would say, for example, if your child gets cochlear implants at age 1, then if all goes as planned, you shouldn't need speech therapy beyond age 5. So, or auditory verbal therapy. And so it kind of depends on where their skills are able to get to in an amount of time. And I've seen in the research has shown that children who get cochlear implants before age 2 can typically be mainstreamed, able to enter regular mainstream kindergarten with their hearing peers by age 5, by age 6. So that's kind of the goal in the research. And if everything goes as planned, and if all the things are in place, then children can typically be very successful in that way. Okay, I think that is it for this video. Let me know if you have any questions. That was a lot of information, just kind of a umbrella overview of what is auditory verbal therapy and what is listening and spoken language and why it's important. And let me know if you have any questions. Please drop them in the comments below, and like and subscribe if you want to see more content like this. And thank you so much for watching. Have a blessed day. Bye.